Bonjour and welcome to everyone. Thank you so much for joining us today. My name is Agnes Grudniewicz and I'm an assistant professor at the Telfer School of Management, where I conduct qualitative research on our healthcare systems with a focus on primary care. Let's get started. It's my absolute pleasure to be moderating an event on primary care. Yes, I am a bit biased. It is my area of research and many of my students will know that I talk about it a lot. But its importance is regularly understated, maybe not in my classes, but in general. And I bet each and every one of you here today has interacted with the primary care system. From maybe a long-term relationship with a family doctor, good for you, hold on to that doctor, or even just a walk-in appointment. These experiences hopefully have been positive, but may have been negative. Regardless of that, it's difficult to argue with the fact that primary care is the foundation of our healthcare system. And today, I hope we can start to give it the attention it deserves. And the question that we'll start with is, what is your role in primary care and why do you think primary care is important?
So you see here is the focus of wellness and the work where primary care attempts to focus its effort. So not just looking at physical wellness, but also mental and emotional wellness, and also recognizing the spiritual overlay, the meaning sense that patients need out of this, recognizing that wellness for the individual doesn't exist without considering family wellness. And that's where family care also gives you that spectrum where we're dealing with not just the individual, but their family over time, and very much contextually driven. So it's about in their community.
I think our patients know that we are the place they go when they don't know what to do, where they can turn, where somebody who's known them for a period of time doesn't have to start asking them all the questions all over again because we've got an ongoing relationship, is able to help guide them through the healthcare system.
Our job at community health centers is to make sure that there is health equity for folks that would otherwise face significant barriers to good primary health care.
Why primary care is important, and everybody's already addressed this, but jurisdictionally around the world, all countries that have prioritized primary care actually have better health outcomes, have much better patient outcomes, they have better population outcomes, they have better satisfied providers. It's everything that you hear about when you think about the quintuple aim. Those countries have been able to do it well.
Let's also start the next question, and we can't ignore it, so we're putting it right up front. In your view, what are the implications of the pandemic on primary care?
You have the chance, looking from a policy perspective, to step back and say, what works? What is the boundaries we're working for? What is the outcome at the end of the day we're aiming towards? And actually, what is the way to get there given the realities and constraints that we're all facing? It's not a zero-sum game.
We have learned a lot from the pandemic when it comes to virtual care. And I doubt that we will ever, as Javed alluded to, go back to the way we did things before. I doubt that we're going to be dragging people into the office for simple things like, check in on your prescriptions and things like that. And then finally, I guess the last thing I would say, and again, it's sort of a follow-up on something Javed had said, is when the hospitals shut down their services, where did those people go? Those people came to us.
Since 2013, since I arrived at Carlington, we've had a no-show rate glass floor at 7%. Since we went to virtual care, after about 4 months, that dropped to 1%. So in providing virtual care, we now have taken away the barrier for a lot of our clients that are struggling of transportation and really who wants to ride a bus with 3 kids in a pandemic anyway. So we really think that that's something we need to embrace and leverage going forward.
I think that this is the struggle we're having right now. The fact that vaccine distribution is taking this, the planning is taking this long, the fact that the vaccines were given to hospitals, and yes, Pfizer needs to be in a special freezer and all that kind of stuff, but that's not their core business. And I don't know if anybody was on Breakfast with the Chiefs this morning, but here they're talking about in the UK, an immunization chief in the NHS who talked very clearly that immunization campaigns have to happen with government, working in partnership with primary care, working in partnership with patients.
Thank you, Kavita, and thank you to everyone. And I hope that some of our audience are feeling inspired. So I've really enjoyed listening to all these various perspectives. Thank you so much to our panelists for coming and sharing